My name is Karen Hosking. I'm the Director of Medical Programs, Government and Stakeholder Engagement for the Humpty Dumpty Foundation. I joined Humpty in March of this year and primarily lead our engagement and development of support for public hospitals and health services across the country.
And I'm Professor Martin Kluko. I'm a Professor of Neonatology at the University of Sydney. I also work as a staff specialist looking after tiny and sick babies at the Royal North Shore Hospital. From a Humpty point of view, I head up the Wishlist Medical Subcommittee, allocating equipment to hospitals around Australia, and I also serve on the Humpty Dumpty board.
Every day is precious, and the equipment that our supporters are donating to wards and departments across hospitals right across Australia just give a bit more of a chance that a baby may get to find a real home and not just spend their life in a hospital.
The founder and chairman of Humpty Dumpty Foundation is Paul Francis. He started fundraising for Royal North Shore Hospital's Children's Ward back in 1990, and 6 years later actually founded the Humpty Dumpty Foundation. Word grew and Humpty extended its work beyond metropolitan Sydney out into regional areas, and today operates nationally to help more kids and support public hospitals and health services right across the country. The Humpty Dumpty Foundation fundraises to provide life-saving and often essential children's medical equipment to paediatric wards, neonatal units, emergency and maternity departments, in hospitals and health services right across Australia.
These are complete strangers to us, to the doctors, the nurses, the allied health professionals, and they hand over the most precious thing, the most precious person in their life, and they say, "We trust you. We want you to do the best that you can."
We were told we needed to make a decision about whether we would...
It's the largest supplier of children's medical equipment behind government, and we work directly with hospitals to ensure that they have the medical equipment that they need on the ground to care for kids. The emphasis has historically been on life-saving equipment, but this is gradually expanding beyond this to essential equipment for prevention and treatment of disease in children. More than 440 hospitals and health services right across Australia have been recipients of support from the Humpty Dumpty Foundation to date. More than $85 million has been raised to provide this medical equipment, and each year on average we provide more than 400 pieces of medical equipment to Australian hospitals and health services. We do want to grow this substantially and provide even more support to hospitals right across the country.
Humpty supplies a wide range of equipment, both in terms of type of equipment and also in cost. So we start off with the smallest items of equipment, somewhere between $500 and $1,000, and they would include things like small monitors, ways to measure oxygen, easy IOs, which provide venous access for children with difficult veins, right the way through to things that, for example, treating jaundice and assessing jaundice, higher level monitors which enable children to be monitored in accident and emergency settings and on paediatric wards, up through ventilating systems and CPAP systems, incubators, and finally our highest cost pieces of equipment, resuscitators or fully set up areas for looking after children who've just been born or come into a department, emergency department, who are very unwell. So range of equipment to many different hospitals.
Humpty has traditionally operated as an events-based fundraiser with annual events like the Humpty Dumpty Balmoral Burn held in Sydney. This is a fun run. The Great Humpty Ball in Darwin and the Great Humpty Ball in Sydney. I think the main point of difference for Humpty supporters is the tangibility of what we do. The need for equipment is identified at a local level by frontline clinicians. It undergoes review and approval through our medical subcommittee, which is chaired by Martin. And the request is then published on Humpty's wish list. Donors can select the piece of equipment that they want to buy for a specific health service, and that is what their donation purchases. So our donors know they're making a difference. We make a point of working very closely with the hospitals to close the loop back to the donor, either through direct feedback, or they might do a tour of the hospital to see the equipment in place and actually meet and hear from the medical teams the difference it's making on the ground, or through more sophisticated impact reporting where we can get this. And I can't overstate the value of this feedback to our donors, and this is one area where we really need hospitals to be even more willing than they are currently to provide quality feedback ongoing. People donating money, they want to know that they're making a difference to healthcare providers and the kids that they look after.
And at that moment, you also realise there's only one thing that can compare to that energy, and that's the mere thought that that child could be in any imminent danger of death. And that's another moment where, as a paediatrician, you're at the interface with that parent who would not only give their life, but their partner's life or anybody else's life to be able to maintain and preserve their own child's life. You want to have the best equipment. You don't want to have average equipment. You want to be able to have the cutting edge equipment to be able to resuscitate that child to the best of your ability and preserve life. Nothing else matters.
Well, again, Humpty has come up with a really great model for enabling us to hear from frontline health workers and provided them with a pathway where they can actually request the information, the equipment that they require in their work. And this cuts through a lot of the red tape and enables us to have a link with the front line. We try and facilitate the way that they make a request through to us for equipment. And then when the requested donations come up to us as a medical subcommittee, we have a number of representatives, medical and consumer representatives, as well as government representatives that allow us to be able to prioritise these requests. And initially, Humpty's focus was on major hospitals in the Sydney region, but fairly quickly we became aware of the fact that there's really under-resourcing happening in our regional hospitals, and particularly when we go further out to smaller health centres. And many of these health-providing clinics were unable to obtain the equipment they needed to properly look after the children and babies that were in their remit. And gradually over the years, they've realised that Humpty is a place they can turn to where there will be facilitation of the need of hospitals as well as the requirement for equipment. And we now have spread to other states of Australia, and our particular initiative in the last couple of years has been the Northern Territory in the top end. And again, there is a lot of health inequity in that area of Australia, and Humpty has been focusing donors and donations into that area for the last couple of years with great success.
And that's what I like about the Humpty Dumpty Foundation, is it's not only about providing equipment, it's not only about funding, it's about constantly questioning what can be done better and how we can make improvements and provide optimal equipment to clinicians.
Of course, it's frustrating for a clinician on the front line to not have the equipment that they require to look after their patients adequately. And again, we've found Humpty has been able to facilitate higher level equipment than may have been provided by the local hospital or the government services. And this is not necessarily a failing of either the hospital or the government. It's just that the requirement for equipment is huge, and the budget and the health dollar is not always going to stretch to be able to cover all equipment. And so one of the things we can advocate for as clinicians is to make people aware of this shortfall and turn to Humpty Dumpty Foundation to be able to fill in some of these gaps.